this to some other committee.
Thank you.
Okay, House Bill 484, Representative Cruz. Drew, would you read it in, please? And folks, I know we got a busy day. This is a very important bill, so please be attentive.
Mr. Chairman and members, House Bill number 484 provides relative to regulation of abortion, provides relative to administrators and owners of abortion facilities, relative to medical records, establish retention periods for such records, institutes penalties, and provides for related matters.
Representative Cruz.
Mr. Chairman, members of the committee, thank you. I know you all are having a long day, so unfortunately we have too, but thank you for your time. This bill expands the duty to maintain medical records at abortion clinics. It addresses the situation that arose last year in my district in Bossier City. Bossier City Medical is now closed, but is confirmed to have unlawfully shredded patient records after the state documented that it failed to notify law enforcement of a 14-year-old girl's reported rape. So she reported a rape, and then these records get shredded. This unlawful destruction of thousands of medical records has serious consequences in the fight against human trafficking and sex crimes. It destroyed potential evidence of crimes and complicated and even obstructed the rights of patients to pursue claims against incompetent and unethical providers. And just as a side note here, if you weren't aware, Interstate 20 up there through North Louisiana is known to be a sex trafficking corridor there. It's a very more traveled than I would imagine. My daughter even did a report on it for her senior thesis, and they've got special troopers assigned to this. It's so prevalent. Bossier City Medical was owned by Ronil Martin, who was a longtime Texas resident who now lives in South Florida. He never lived in the state of Louisiana. Bossier City Medical was operating until the spring of 2016 when Mr. Martin closed it, immediately after a number of serious violations of the law were identified by LDH. Not surprisingly, he also closed his Causeway Clinic in New Orleans. You may be familiar with the story of Dr. Kermit Gosnell, who is in prison for killing women and babies at a clinic in Philadelphia owned by Mr. Leroy Brinkley, who, by the way, is also the owner of 2 clinics in Louisiana. When law enforcement subpoenaed Dr. Gosnell's patient records from Brinkley's clinic in connection with Dr. Gosnell's hundreds or maybe even thousands of murders, Mr. Brinkley produced only 3 files and was unable to explain what happened to the others. Well, in this case, we know what happened. The owner directed that the medical director or the clinic's medical records be shredded by the custodian. In Louisiana, the clinics have a long history of failing to comply with the legal obligation to properly maintain medical records, in addition to misreporting information to the state. Existing law fails to provide adequate enforcement mechanisms against such individuals, both to deter them from violating the law and to ensure adequate consequences for those that do. I've got some evidence here, and I submit this in support of the bill. And in this binder, we've got reports on human trafficking, testimony by Leroy Brinkley to the Pennsylvania grand jury, and the report of the Gosnell grand jury. Deficiency report showing record-keeping violations involving all the key personnel, and Ronil Martin's own admission that he directed the records to be shredded. The documents submitted to this committee show that this conduct is neither isolated nor outdated. We have passed good laws intended to protect women and to show our state's profound respect for life, but we also care for our women who may go to one of these clinics. I ask for your support of this bill, which is intended to expand responsibility for protecting critical patient information and evidence. And just to tell you exactly what that means, right now, only the custodian is responsible for those records, and we would extend that to at least 4 parties: the owner of the facility, the physician that performed the abortion, the medical director, and the custodian again. So we just want to expand that and have some enforcement penalties. All other medical clinics have to retain records. We don't see why this type of facility wouldn't also have to do that. And with me, just to
Either one of you.
introduce Ben Clapper, Louisiana Right to Life, and Liz Murr from the AG's office.
Thank you, Mr. Chairman, and thank you for hearing this important bill. I know you've had a busy day today, and members, I appreciate your attention. We did learn, I represent the state in 5 out of the 6 cases that are challenging virtually every abortion regulation that the legislature has passed. And it was discovered in the course of those cases that Mr. Martin had directed all of the patient records to be shredded at Bossier, and we think the same thing happened at Causeway. I think you know that or maybe you don't know that doctors are required to keep their medical records for 6 years, and imagery for 3 years. And the clinics under the abortion regulations are required to keep their records for 7 years and 10 years for minors. And for minors, it's especially important because of exactly what was documented in the deficiency report, where a minor may come to an abortion clinic to have an abortion and report a rape, and they may be the first people. Traffickers are frequently women, or 50% of women who've been trafficked are reporting that they have been to an abortion clinic. And so sometimes that's the first time that they may have contact with these people, and the first opportunity to report and to allow law enforcement to touch them, or health personnel to touch them outside the clinics, social workers or otherwise. Those records are shredded. Whatever evidence that those people might have had, they're gone. It's gone. So when we looked at it, we saw that it would be, I think that Representative Cruz has a good bill because it expands the number of people who are responsible for maintaining those records and incentivizes them to follow the law and has penalties for them if they don't.
Thank you, ma'am. Ben?
Ben Clapper, Director, Louisiana Right to Life, Chairman and members, thank you so much for your time. Just to echo that this bill, Louisiana Right to Life, supports this measure. The fact that the physician under law currently has to keep the records for 7 years, it seems that is currently in violation after these records were destroyed at Bossier. In addition, the unreported rape of the minor and the failure to properly complete the ITOP reports, these all have penalties associated in our laws that you've passed over the years. So today we sent a letter to the Bossier Parish District Attorney, the Department of Health, and the State Board of Medical Examiners, asking them to investigate this matter because it seems to us that there's basic violations of state laws that are present. Moving forward, this law will help hopefully to prevent that in the future from happening by broadening the responsibility to keep these patient records so that a month after a facility closes the doors, they don't shred their their patient records, therefore preventing the ability of law enforcement and patients themselves from accessing their medical records in the future. I ask your support of this bill. Thank you very much.
We have a question from Representative Bagley. Sir? Oh, okay, you just make a motion to move? Okay. We have several cards that are in favor but not wanting to speak and but present and in support. Dr. Bridges, Louisiana Academy of Family Physicians; Charles Carpenter, Baton Rouge Right to Life; Kathleen Benfield, Louisiana Family Forum; Ann Steyer, National Association of Social Workers, Louisiana; Stephen Wright for the Louisiana Chapter of American Academy of Pediatrics, I think; Maria Brown, Louisiana State Medical Society; Nick Gautreaux, Direct Solution Strategies; Nick Wantz, Louisiana Primary Care Association; and Billy Yelverton, Louisiana Academy of Family Physicians. We also have a card that President would provide information if needed. Scott St. John, from the Attorney General's Office. We do have some opposition and some would like to speak. Linda Hawkins, if you'll come forward, please. Louisiana League of Women Voters. Also, Ellie Schilling. You'll come forward, Ms. Schilling. We have 4 other cards in opposition but not wishing to speak. Jessica Fanhill, Michelle Ehrenberg, Media Landry, and Ann Steyer. Yes, ma'am.
Good afternoon. My name is Linda Hawkins. I'm with the League of Women Voters of Louisiana. I am the Healthcare Program Chair. I also have specific knowledge on healthcare records. I've been the custodian of records for large VA hospitals, a Privacy Act officer, and the Freedom of Information Act. So I have had a long history in medical records. I would like to talk with you. I know you do have some new members, and I know I'm time limited, so I will speak very fast. The mission of the League of Women Voters is a political organization. We're encouraged to inform and active participation. We work to increase an understanding of major public policy issues that influences public policy through education and advocacy. We've been around since 1920. We got the right to vote for women. We're a part of that and came into Louisiana in the 1940s, so we've been around a while. Now, as the League of Women Voters' position in health care, we measure all of the policies when we start looking at it as a basic level of quality health care at affordable cost should be available to all Louisiana citizens, including behavioral costs, using effective and economical cost control mechanisms, tools, and techniques. Representative Cruz 480 bill, as I understand it, is only focusing on abortion clinics, health clinics. My concern in this whole bill, and I'll go through it really quickly, it does not support efficient and economical approach to quality health care. It's costly, it's ineffective, unaffordable, and it's a state overreach. It's fiscally unsound with increased health care cost. It appears discriminatory on its face. Why? Because it targets and singles out businesses for women's health issues only. The bill ignores and fails to include other bill entities such as hospitals, freestanding clinics, private entities, prisons. They also provide women's health care, and they also should be followed in this bill if, in fact, that is the intent of the bill. It is bureaucratically burdensome and does not identify how and who on an ongoing measure will monitor all of this. Reviews. Yes, after the fact, you find out about it, just like Representative Cruz said. But who's going to do the on-term monitoring daily? Who's going to pay for that? The bill itself, to me, does not cover what is needed. The bill's stated concerns are not covered in what is happening. He's not identified private and public entities that need to be covered. The cost-benefit analysis was not done, and it's going to affect the businesses. Guess what? Businesses. These are businesses. Suspected criminal law and enforcement issues should be applied equitably across all healthcare entities, regardless of the nature of the business, not just abortion businesses. In your hospitals, in your boutique clinics, in your surgery centers, if that's what you're going after, and if in fact it is about trying to preserve and protect people, it needs to go equitably across the board. We ask the committee members to oppose the bill for the stated reasons under the HIPAA, as well as was stated earlier. Yes, the HIPAA regulations, federal regulations say 7 years. The state can go ahead and impose more if it's appropriate. However, the entities that must be administrative, technical, and physical safeguards to protect the privacy of medical records, contents, and protect the information for whatever period, including through disposal. So the folks that did do this and disposed of records unlawfully, they need to be held accountable. Absolutely. But don't single out women's health care services. Across the board, I ask you to expand the bill if that is the concern. Otherwise, the way the bill is written does not seem to be focused on the issue or the intent. Thank you very much for your time.
Yes, ma'am.
Thank you, representatives. I'd like to be clear first about some of the facts that were stated in terms of the closure of the Bossier Clinic. The owner was very clear, this is probably the affidavit that you have, this is a public record, that the reason that he had shredded the records after the clinic closed is that he was very worried about patient confidentiality concerns. Not only had he moved to another state, he had no business operations at all in Louisiana, no employees, there was no one around. Just keeping records somewhere endlessly creates patient confidentiality concerns. This bill would require clinics to keep records for 30 years if there's any issue suspected that would have created a mandatory reporting or that anything about the patient was reported to law enforcement for 30 years. For minors, it's 10 years after the minor turns 18. So we're talking about having these records for a really long time. And how then are you going to be able to ensure that patient confidentiality is protected? There's other problems with the bill, too, in terms of its stated intent about trying to... I know it's late. That's all I have for today. Any questions? I would be happy to answer them.
There are no questions. Thank you, though. Representative Cruz, you want to close?
First of all, I would like to introduce that amendment set on there, make sure we get that recognized, which actually addresses most of these concerns, and I'll go through that. First of all, I want to point out that these records were shredded 4 months after these violations were reported. As soon as they found out they were in trouble, the records were shredded. So it sure seems suspect to us. Oh, read in the amendments. Drew, go ahead.
Yeah, I'm sorry. Let's read these amendments in.
Mr. Chairman?
And while he's preparing to do that, I'm going to announce that we're going to have to stop after this bill to go into session, but we will plan on meeting after the session ends tonight to continue with the other 199, 230, 243, 284, 375, 424, 431, 536, and 537. Yeah. All right, Drew.
Mr. Chairman and members, the set of amendments is coded 1238. 1238 is the code in the top right-hand corner. This is a set of 12 amendments. I'll only call in the ones that are substantive in nature. Amendment number 5 occurs on page 2, adds a type of record to be maintained by the abortion facility. Amendment number 6 clarifies the retention period for adult patients and patients who are minors at the time of the abortion. Amendment number 7 on page 3, delete lines 1 through 15 in their entirety. These are provisions relative to penalties, and insert the language that you see in the amendment document, just different clarified language on penalties. And then amendment number 12 is the final substantive amendment. There are 3 additional amendments that are in set 1092 that are technical in nature only. So these will be included in the set before the committee. So 3 additional technicals in addition to set 1238. This concludes the extent of the amendments.
Representative Cruz, any comments about the amendments?
They just clarify some of those points, and they basically, what I wanted to emphasize is really the objections are covered by these amendments, such as records retention. Some of that is covered in the bill or the amendments. If you have give the LDH your records on a digital media, you can be absolved of retaining them anymore after that period of time. So we do realize retaining records forever is difficult, if not impossible, once you close a clinic. So why not put all your records on digital media, give that to the AG, and then you're covered there. Department of Health, I'm sorry. The custodian, we also want to point out in this particular case, was terminally ill, and that was known by the clinic director. So we're trying to make a provision so those records are retained and people understand what's going on, and there's penalties for not doing so. So we think that was very clear. One of the witnesses talked about this was only for abortion clinics. Well, every medical facility has to retain records, so this is really getting them in line with that. That's what the purpose is. And they've been required to do that. They just haven't. So we're trying to put some teeth to that so they will in the future. Patient confidentiality, just like we said, now it's going to be able to be on digital media. You won't have to worry about that anymore. It's not your problem once you've got those and delivered them to the Department of Health.
Representative Miller, you have a question?
Yeah, just a quick question, Mr. Chairman. 30 years, if that's the present law, if someone report any type of child abuse, that they must retain the records for 30 years, or is that what you're adding?
30 years is reduced in the amendment to 10 past majority, which I think is consistent with current law, but the 30-year period does apply. 30 years is the length of time for the state to prosecute a sex crime against a minor, some of the worst sex crimes against minors. So that 30-year would have aligned with prosecutorial time period, but it is a long time to have to keep records, and so we worked with the author on reducing it to 10 past the age of majority.
Okay, and LDH has the capability of keeping this data that you said they can transport digitally if they would like?
LDH retains a lot of data for a lot of reasons, and clinics currently report into an electronic system with regard to certain data that is collected by LDH related to the termination of pregnancies. This would permit an option that would avoid the long-term storage costs that could be associated with having to maintain the paper records, and it might cost a little bit to have them scanned and even encrypted, but you can do that and still save the amount of money that it would cost you to retain them for a 10-year period, and that's going to be substantially less.
Last question. Do you think there's a possibility we would lose any type of lawsuit since this is the only medical entities that we're going to require this strenuous amount of time of holding records? I'm not an attorney, so I'm asking.
So it's not it's not
it's just longer than a
enormous amount
normal
of time. I mean, it is relatively consistent with the time that is required of all medical facilities. But
most medical
it is
facilities are
also
more on a
justified.
5 to 6 year pharmacy. How long? Okay, so he sent pharmacy summer 10. I just thought that medical primary care providers was more on a 6 year. So I'm just asking. I'm not saying it is. It's really just an educational question for myself.
It depends on what kind of facility you are and who you're regulated by. Doctors have their own separate requirement of maintaining their patient records, and I think that was violated here too. But all I can tell you is I don't have any evidence of this happening in any other facility. I do have evidence of it happening with this one and this particular situation where people knowingly destroyed records in violation of the law, regardless of their reason for doing it.
Yes, ma'am.
And there was the law requires the clinics to designate a custodian of records so that these time periods that in existing law can be complied with. And the person that was designated was terminally ill, so we conveniently have a person who was designated as a person of responsibility who's dead. We have records that have been shredded. We have very few people under current law that are clearly responsible for that. So all this law does is clarify who's actually responsible for maintaining the records and who might pay penalties if they don't do that.
Yes, ma'am. I'm just curious as far as the law, this shouldn't go into court and get overridden because it's not matching the primary care providers' normal length of time of storing records.
I cannot tell you they won't sue us. I can tell you that I think we will win.
That's all I needed to hear. Thank you.
Thank you, sir.
And last thing in closing here, I do want to mention this really is a women's and sadly a child's bill. I mean, we're trying to stop trafficking and predatory practices, and without records, what do? You just suspect this stuff and can't do anything about it. We were just, I hate to use the word lucky, fortunate that some records were discovered that showed that reported rape was not, followed up on. So that was evidence enough to know something else is going on probably. Let's make sure we retain these records like we do in other clinics. So
Okay, I'm going to move that we approve the amendment. Is there any objection to the amendment? The objection, the amendment stands. We have a motion by Representative Bagley to approve House Bill 484 with amendments favorably. Is there any objection? Without objection, we'll move favorably.